Well, hello, everyone, and welcome back. I'm Carolyn Colley, and I'm president of the U.S. Chamber of Commerce Foundation. If you joined us yesterday, we're sure glad to have you back. I mentioned yesterday that at the Chamber, we really believe that business is a problem solver. And we come to work every day thinking about new problems, particularly around vaccine hesitancy. We need to get people back to work and back to health safely. So today we're going to build on yesterday's conversations around attitudes towards vaccines and explore how employers can help solve the problem of vaccine hesitancy. We've all seen the data that show that too many Americans are either unsure about getting the COVID-19 vaccine or they say they will never get it. And that is disturbing and it's unsettling. And it makes us ask the question, what is the role of employers? What are the right messages? And what will resonate and motivate people to action? So today you'll hear from experts in messaging. We know messages matter a great deal. We're going to hear from leaders who've been on the front lines talking to the public, focus groups, testing, message testing, and talking to employees and employers who are sharing best practices. We've got a lot of education to do and a lot of motivation to do. So thank you for joining us today. I hope you'll find collaboration and ideas and support in these conversations. And please know that we're here to help. I hope you'll consider our foundation a resource and a friend as you move forward on this hard work. And I do have one ask of you, which is ask questions. We've got great speakers today. I think you'll hear some new things that may be surprising to you and show us how hard the work is going to be. So please start filling up the chat with those questions so we can be on target and on point for you. So let's get started. Thank you again.
Hi, I'm Eileen O'Connor from the Rockefeller Foundation, and we've been working with a lot of the states and the cities and mayors and others, and now in schools with school superintendents around the issue of testing and tracing as well as vaccination. And until, unfortunately, everyone is vaccinated, no one is safe. So for employers, you too will still need to do things like having social distancing, people wearing masks, as well as people getting tested, even when they don't have any symptoms. There's a lot of great tests coming onto the market that people can take at home, your employees could take at home, or they could take at work that will give them almost instant results. And so these are easy tests to take, and there's something that will keep you all safe, your employees, and if you have retail operations, then your customers as well. So we can show the slideshow, please. So the messaging around testing and tracing, let's go to the next slide, is very similar, in fact, to, and the hesitancy is very similar to vaccination. So only about 82% of adults were willing to actually even wash their hands, although 78%, 76% are also willing to stay away from other people and wear a mask. So that's a lot higher than people assume. 66%, especially those who are vulnerable, do stay home as much as possible. 59% got tested for COVID, and 49% talked to a health worker. So the one thing is that the problem with testing, and the reason that a lot of people don't get tested, is they feel like they're going to take too long and they're going to be around other sick people, or they're going to miss the appointment. That's not the case anymore in most states. You can readily get tests. And you also, as an employer, you can have access to the tests. Many of the states are now getting there's as many tests as possible going to the states, so you can also talk to your to the governor's office, and many of them will be able to access tests for you. The Rockefeller Foundation, in fact, has a advanced market agreement, and we can also get tests for employers. So let's go to the next slide. So motivating messages for testing and for vaccine is just about the same. You want to talk about doing your part, that this is that we're all in this together, and that if others are doing it, then I should be able to do it. And I should do it for myself, but also for others. Do it for them. Put other people in the picture. So when you talk to your employers, talk about the fact that getting tested or getting the vaccine is also, you want them to do it so that so that they can be protected, that they can protect their families, that they can protect their community, and do so before it's too late. Describe what is to be gained by acting now and acting as quickly as possible, and what's to be lost if we don't. Because right now, and we can go to the next slide, right now there is, these variants are moving their way through the United States and through Europe and other countries. The more the variants are able to be out there, and as we know, the UK variant is much more readily replicable and is much more virulent, that means that it's spreading much more rapidly. And when it does that and goes through the population without being stopped, it actually mutates even more. And so what we want to do is stop this before that mutation ends up being a mutation that the vaccine may not be able to cover. Right now, the vaccines are covering these variants. So please tell your employers, your employees, that this is, and your customers, that vaccines are safe, they're effective, and the faster they get them, the better off they'll be. So we also want to tell people that we've done testing on many of these messages, and we know that doing your part is a message that people do feel comfortable with. Doing it for them and before it's too late are also things that that work, especially in relation to testing. You want to be able to say, if you test positive, there's a short window of time to pinpoint who else might have been exposed. So this is where contact tracing comes in. Next slide, please. So we also want to do something. It's not any good to shame people for not wearing a mask or for believing that a vaccine might be harmful. You want to meet them where they are. And so what we want to talk about is talking about others who've had the vaccine, talking about the science behind the vaccine, and also the fact that if they don't participate, that it's hurting themselves, but don't shame themselves. Keep going, please. Next slide. So if you can talk about the people that they will protect, like their sisters, their grandparents, their teachers, frontline workers, being as specific as possible about the people they're protecting is very much, is very effective. Go to the next slide. Because this kind of thing paints a picture in people's head when you're pretty specific. So the other thing is that we want to make sure that you pair the loss regarding what happens with delay. So you pair the loss to gain that sense of urgency. Next slide, please. Keep going. Sorry, this is about testing. I want to get to vaccines. So a lot of people say if I had tests at home, they would take them. Well, now there are coming online a lot of tests that can be taken at home. So that's a good thing. Keep going, please. So the messaging parallels, as I said, between testing, tracing, and vaccination can be considered through these same frames. Doing your part, getting a vaccine as soon as you can. And also, if you're an employer and you've gotten the vaccine, if you can show that to your employees, that would be very powerful. Or talk about those who've been able to get the vaccine. We also do know that messengers, and I'll go on to that next, make a big difference. So, and also talking about getting the vaccine so that it protects other people. Doing this, doing your part so that you protect others, doing it for them. And then also, again, getting the vaccine before it's too late, because we are in a race against these new variants, and really time does matter. Please go to the next slide. The messenger, and this I want to spend some time on, the messenger matters very, very much. If you can bring in a local doctor, it is super effective, because the studies that we've done show that medical personnel who your employees might be familiar with are very important. So if, say, it's if there's a local community clinic and there's a doctor who maybe sees a lot of your employees, or also if you know that there are certain, if you're in a smaller town and there's only a few, say, pediatricians or primary care physicians, bringing a couple of them in to talk to your employees about the vaccines would really make a huge difference. Also, start the conversation, not an argument. don't say that someone's wrong for being fearful. Again, this is not this is same as with testing. You want to empathize with the fact that they have concerns about the vaccine. And many people, particularly in minority populations, maybe don't have access that much to healthcare, or they've also been exposed, or we know that certain minority populations have been taken advantage of by the medical system historically. And that's a big problem. So what we do want to do is talk about the fact that we don't want to diminish their concerns. We want to make sure that we acknowledge them, recognize them, but then go into the messages about the safety of the vaccine, the fact that a lot of people were tested before these vaccines were allowed to get emergency use authorization, and the vaccine manufacturers went to great lengths to get a variety of people, ages, with comorbidities, as well as those in minority populations. So these vaccines have been widely tested. And right now, many millions have been already vaccinated, and it is showing to be very safe. People will feel a little bit sick. The second dose, some people say that they've gotten a little bit sicker. So you want to make sure that you do that kind of risk communications where you acknowledge that they may feel some pain, they may feel a little bit sick, but even if they were later to get COVID, this will in fact enable them to get a far less dangerous case. And it will also protect others from getting the disease because they will not be infected. So I think that's I want to give more time for your questions. And I also wanted to just say that, this is something that's critically important. Both the testing will have to keep going because the fact that until everyone is vaccinated, we still need to be able to stop this disease in its tracks. Thank you.
Hi, good afternoon, everyone. My name is Crystal Sun, and I'm the Director of Healthcare Analytics at Civis Analytics. We're a data science advisory and technology firm, and we've been fortunate enough to be working with the state of Illinois and helping support their COVID-19 response. Thank you to the U.S. Chamber of Commerce Foundation for assembling this panel of presenters and inviting us to be a part of this event. We're really happy to share some of the insights that we've gathered through our vaccine messaging research, and more importantly, how that's been applied in the state of Illinois. Anne, do you want to introduce yourself, and maybe you can start with a description of what kicked off our partnership last year?
Sure, and thanks, Crystal. My name is Anne Caprera. I'm the Chief of Staff for Illinois Governor J.B. Pritzker. I've been with him for the last 2.5 years. It feels like 15 years of his term. And very happy to talk to you today about the partnership that the state of Illinois has with Civis, and kind of why we brought them on board. Almost a year ago now, when the pandemic kind of descended upon the world and really descended upon the United States, every state government was trying to get a handle on what we could expect. And the reality is that the world community hasn't faced something this dire really in 100 years. So we didn't have a lot of experts sitting around necessarily able to tell us, what to expect in terms of the public health response and how to communicate with our citizens. And one of the first things we really needed to get a hold of it was how to model the path of the virus. And that's where we turned to Civis. We have some incredible research institutions in Illinois, and we had teams from each of those institutions putting together models on the course of the infection rate, the positivity rate, what we could expect to see in terms of hospitalizations and unfortunately deaths and mortalities as we went through the course of the pandemic. We brought Civis in really to kind of converge those models and tell us, okay, based on all the information that's out there, what is the best estimate that we have in terms of what we can expect based on what mitigations we put in place throughout the state, and really what we're going to talk about today, what we can get the average citizen to do to help mitigate the virus. That model helped shape all of our policy making here, being able to tell, when we see a certain number start to rise, what that could look at 2 or 3 weeks down the line, was really critically important to trying to stay ahead of the pandemic. And it really has every step of the way been an attempt to stay ahead of the disease as it's progressed. When the governor actually first stepped out to talk about this, we were doing press conferences every day. And that first week really where we were in front of the press and the public on a daily basis was the week of March 9th back in 2020. And in one of his first press conferences, he said, this is going to affect your daily life. I mean, how true, we didn't know that was going to be at the time, but it was setting kind of the start of the conversation with the public around a public health crisis, which is much different, frankly, than when we deal with other types of crises in the United States in government. We needed to really say to people, this is not the normal sort of thing that you've dealt with in the past, so that we could set that baseline of expectation. The next step was, okay, you know, there's mitigations that the government can take in terms of closing down certain businesses, limiting certain gathering. But the truth is the majority of the effort was going to come on the behalf of individuals. And that looked like wearing masks, deciding personally not to host large gatherings. As we got to the holidays, making decisions about not having events with family members that could potentially act as super spreader events. And now in these last few months, how do we convince people to get vaccinated? So at each step of the way, you're really trying to approach the public and persuade them to do something that, as the governor noted at the beginning, isn't really a part of their normal daily life and not something that we can force them to do. So, we needed to find ways to convince them to do this. And motivate them. I have both a government and a campaign background, and I will say that part of this for me was looking at when we do campaigns, how do we convince people to vote for something? How do we convince people to show up to the polls? We have to kind of apply the same logic in some senses to convincing people to wear masks, convincing people to stay inside, convincing them not to hold big holiday events. So we worked with Civis on that. Crystal's going to go through for you the kind of 3 types of research that we pulled together to lay the groundwork for our communications efforts. One of which is message testing, which basically looks at what's the most effective message that you can use. One is surveys, where it's really like polling. We're looking at different attitudes and behaviors based on what our citizens are telling us. And then for any cash-strapped organization, and certainly state government was one of those, how do you best deploy the limited budget that you have? One of the most important things when you're doing message testing and making decisions about this is to put your own biases aside, to not approach this from, well, this is what would persuade me to do something. Usually if you're in a decision-making capacity, you may think a little bit differently than the public at large. So we needed to both identify the people we needed to reach, and we needed to understand correctly how to reach them appropriately. And so I'm going to turn it back to Crystal to talk about those research efforts and how they came together.
Thanks, Ann. So at Civis, whether the end objective of a particular campaign is to identify and engage new customers, or it's to help connect people who are eligible for government aid with that assistance, we believe that data and objective testing have to be at the heart of it all. And I think one of the reasons why this partnership has been so successful has been that the governor and folks on his team like Ann share in this philosophy and this approach. So for every campaign, we follow a 5-step approach, and that consists of, number 1, describing who the population is that you want to reach and who's in it. So how large is it? What is the demographic and geographic makeup of it? Number 2, understanding what people in this population believe, what they want, and what they need. So why are they not following precautions? Is it confusion, or is it outright refusal? Number 3, testing what to say and how to say so that it's persuasive against a sample of this population. And then importantly, measuring impacts on your key outcomes. And we'll go through an example of how this played out in real life shortly. Number 4, we strive to implement through tools that are really designed with input from users. And when we say tools, these can be fully fledged and complex as custom software applications, or they can be as simple as quick dashboards. The point here is just to meet the users where they are. And then last of all, we cannot stress enough, measuring campaign effectiveness throughout the entire process is really critical so that you can make the adjustments and pivots that you need throughout. So back in the summer of 2020, we had the opportunity to work on implementing this cycle when we were helping the state understand and increase adherence to mask wearing in public. In addition to doing survey research to understand baseline measures of mask wearing and identify, are people just confused? Are they just outright resisting? What are the drivers? We help them pick the most persuasive creative. In this case, Civis conducted a randomized control trial. This is the same type of framework that's used to test drug treatments, for instance, to test different options that were drafted by the state's advertising partners. And they all conveyed the same core message, which was that, yes, it's very important. You should wear a mask when you're in public. But the reason for that importance was different from message to message. That was what made each message unique. So the slide that I'm about to show shows you how this concept works. So what we do is we take a random sample of the target population. In this case, it's a random sample of Illinois residents. Creatives can be either fully developed videos or images, or they can be early concepts described in text, or even just messaging points if you're at that stage of your process. And then the group is randomly assigned to either view one of the creatives, or they're in a control group where they see no message. Following that exposure, they're then asked a follow-up question. In this case, it's how likely were you to wear a mask? In our vaccine message testing, it's how likely are you to get vaccinated once that's available to you? And then we build and score a statistical model to help identify how persuasive what was each creative. And more importantly, were any of the creatives likely to create negative backlash, or the probability that somebody is going to be less likely to comply with what you're trying to get them to do as a result of seeing your message. So this slide shows the 5 different pieces that were tested. In this case, comparisons, which is the first one, resulted in a 3% increase in self-reported likelihood to wear a mask in public. So that was the, quote, winning message. Once we identified the most effective message, we worked with the state to integrate the insights into its media buying strategy. So what that looked like was that on a weekly basis, we updated a formula created by the state that prioritized counties by risk and then assigned a greater share of ad spend to areas with greatest need. In addition to that, the media buying campaign, some of the insights that were generated from our research and testing were incorporated into public statements made by state leadership, as well as content creation and design of things like brochures and other materials at contact tracing and testing sites, for instance. So there are widespread applications beyond the media buying as well.
And the great thing about this was that once we implemented this campaign, we were actually able to see mask wearing across Illinois increase by about 21% since the launch of this effort. And we've been incredibly lucky to see our COVID transmission rates amongst some of the lowest in the country as a result. And that told us, obviously, that our campaign here was a success, and a success that we want to build on, because we're now going to adopt a similar framework for COVID vaccine communications. And I just want to reiterate what was said earlier from the Rockefeller Center. You know, there are people mistrust different things for different reasons, and you can never assume that you know all the reasons why someone doesn't want to get a vaccine or why someone doesn't want to wear a mask. You have to be actually really open to the reasons why somebody gets to where they get to, and you have to meet them where they are, and be willing to do that if you're looking to run an effective campaign. You know, after doing our research, it was actually really interesting to see similarities among our previous message test results, emphasizing the personal benefits. For example, personal safety with masks and effectiveness with vaccines was very effective. In contrast, messages that talked about the community benefit, like keeping your friends and family safe or being trusted by doctors and backed by science, were likely to result in a negative backlash or causing people to be less likely to wear a mask or get vaccinated. Those results surprised me. I thought the community message actually would be particularly compelling to people. It wasn't. And I thought, you know, talking about protecting friends and family wasn't really as effective as we wanted it to be. What really worked? Comparing a mask to a seatbelt or a football helmet. This is why we do research. And then you've got to trust that research once you find it, because this issue itself is so important, and we can't afford to fail when we're using really limited state resources to try to convince people to do something that they wouldn't normally do. Just like we did with our mask wearing campaign, we're going to use these insights to build a data-driven campaign to ensure that people trust the vaccine. Some of it is the paid communication effort, but some of it is actually really simple. For example, right now at our vaccine sites, many of them offer things like selfie walls, because if someone takes a selfie showing that they're getting a vaccine and posts it on their social media board, that acts as kind of a word of mouth endorsement for the vaccine. And particularly when you're talking about those healthcare providers, local community members that are trusted, those are the folks we really want to get to, because they convey trust about the vaccine, and make this part of what we want it to be, which is a science-based approach, even when people don't want to hear about science.
So I think we're right up at time, and I'll just conclude by saying that there are some key takeaways that we've gathered across all of the vaccine message testing that we've done, and we're happy to share that with all of the folks on the call. One piece in particular is a research study that we just wrapped up this week. We did in partnership with the Chamber of Commerce Foundation, who told us that employers in particular are really interested in knowing how to motivate employees to get vaccinated. So to do this, we ran a test of 5 different messages crafted in partnership with the Chamber. And we found that an employer, if an employer were to talk about how company leadership would get vaccinated once they meet eligibility requirements, of course, those were the most persuasive messages for employees. In contrast, an employer message about how a company can offer accommodations or incentives to employees, those are actually ineffective and likely to result in negative backlash. I'm happy to share all of those results and disseminate those out to the folks here, as well as answer any follow-up questions. Thank you.
Hello, now we move into the fun Q&A portion of this. Thanks to our panelists for sharing their expertise. Please submit your questions. We'll try and get to as many of them as we can in the next few minutes, and then we'll welcome the next group of panelists to talk about their perspective on these important issues. Eileen, I'll start with you. What does testing and tracing have to do with vaccines? Can you put a really fine point on that? How does this all fit together? Oh, you're still muted.
I was typing, so until everyone is vaccinated, then like I said, until everyone's safe, no one is safe. And so the problem is that the disease is still going to be running through the population. So you want to catch people who are sick early on, because that's when they're most infectious. And we do know that asymptomatic people with no symptoms whatsoever are responsible for upwards of 50% of the spread of the disease. That's why testing is so important, because once you know that that person is infectious, and there's 2 types of tests, PCR and antigen, but the antigen tests, we keep trying to say, they're not quite as accurate as the PCR, but they're super accurate when you're really infectious. So this is why getting any kind of these rapid tests will still be important and will catch most of the people who are most infectious. So you want to stop it because, number one, you don't want to expose other people who may be vulnerable, like elderly people or people with sort of comorbidities like diabetes, obesity, et cetera. And you also want to be able to stop these variants from kind of mutating again. So that's what's really important.
That's great. Thank you. So Anne, thanks for sharing your perspective. Illinois has been very busy, and I imagine you're going to be busy for quite some time. What do you see as the role of the private sector in your state's response to the next stage of the pandemic?
Well, it's critical because truthfully, a lot of what we're doing here is working on outreach through employers, through local community businesses. Obviously, there's a role for government here, but a lot of the places where we've seen spread, whether it's in restaurants and bars or, in closed manufacturing sites, these are the places that we're going to try to be hitting up as much as possible as the supply of vaccine increases over the coming months. And, having an employer say, it's important to us that you get vaccinated, and work with the state to provide those opportunities, work with employees who, may be hesitant to get vaccinated for whatever reason, but either bring information to them that will help convince them. We work with our unions here in Illinois in order to ask our union reps to go out and educate their employees on the importance of getting vaccinated. And I would also say, helping to bring in local trusted community members. The most trusted person you can find is a nurse or a doctor, somebody who works in your local healthcare community, to maybe physically get the vaccine in front of folks, or to point people to in order to help convince them to get vaccinated. Those are going to be those important touch points all the way down the chain in order to make sure that we hit our metrics for vaccination.
So, Crystal, one, thank you for the research that we're going to release this week on the messages from employers that work the best. And I appreciate the summary you gave earlier. Can you explain when you talk about accommodations and that triggering a backlash, what you mean? Because when some employers hear about accommodations, they think that we're referring to the Americans with Disabilities Act, which requires you to make accommodations for employees. Can you explain in the context of this research what that meant and what you found?
Sure. One of the things that we discovered in our pre-research before launching the message test was that employees were very curious about what kinds of benefits could their employers offer to them. And some examples of this include, because I think examples help describe it the best, paid time off after receiving a vaccination in case they have adverse events or adverse effects due to the vaccine, bringing vaccines on site, helping them schedule a vaccine, some of the logistical details. We've also seen some stories about employers that have offered incentives like a $5 gift card or some sort of monetary or gift card in order to incentivize them to take the vaccine. So we were curious if, we couldn't make it a broad statement that your employer will give you those things. But if your employer were to help support you and give some examples of those kinds of incentives, we were curious if that would move the needle and help persuade people. And it actually wasn't. It was it was the least performing message out of all of them. What was really motivating for most people was a message that talked about company leadership getting the vaccine first when they are eligible for it, of course. But that's also at the high, overall population level. We did see some interesting variation by subgroup. And what I mean by that is that, for instance, women in particular seemed more persuaded by a message that talked about how if you're an employee and you get vaccinated, you can help us get our company back together. You can help us have more job security. So if you look at pockets of some of the participants, we did see a little bit of difference in what messages really resonated with them.
So I could talk about this all day. Unfortunately, the clock is a wicked beast today, and we're running out of time. I'm going to ask Eileen the last question. Someone has written in, do you have recommendations for helping vulnerable populations, non-English speakers, racially and ethnically marginalized communities understand the vaccine? Still muted.
I've been typing a bunch of links into the chat in order to answer some of the questions for your folks. So into the private chat, I hope you can share those links.
We will.
We actually recommend going hyper local. And in fact, we have some pilots with about 12 communities. And that really means you have to, exactly what Anna and we're all talking about, you have to really see who that audience is, and every single one of them is very specific. So they will have different cultural issues or fears or other concerns that are very unique to them. So you have to go hyper local, and in that way, what you need to do is to is to use also local community leaders. For instance, faith-based leaders, as well as we used a cultural icon in New Orleans, and Big Frida, and she did a rap song on testing early and mask wearing, and it was really, we measured it as well, and it was very, very effective. We also look at sports icons, and that doesn't necessarily mean a professional athlete. That can mean a coach of the high school or someone who people really recognize. And I also think, you know, small business owners are trusted in the community. And so there's a huge role for small business owners to play in this, to put up posters in your shops, and to be able to have information readily available for employees and for customers.
Thanks, that was great. And for any small businesses that want to do their part in the community, we have a number of resources on our website that we're constantly updating. Go to uschamberfoundation.org. One of the things is a customizable flyer that you can put in your window to identify the things that you're doing as a business to protect your workers and your customers. And it can, you know, set an example for others, but also reassure people and be good for the economic recovery that we all need to see as well. So thank you to Eileen and Crystal and Anne. We appreciate the work you're doing. We really thank you for joining us today. Next, we're going to dig a little bit deeper into the role of employers, and we're going to start with a conversation about what employers are doing and can do. Thanks. I'll be back in a bit.
Good afternoon. My name's Tara Azimi, and I'm a partner in McKinsey & Company's healthcare practice. For those of you who don't know McKinsey, we're a global management consulting firm, and we have the privilege of serving clients across public, social, and private sector at scale globally. And since this pandemic started, have had the privilege of serving over 1,000 clients on COVID response, as well as adapting to the very challenging circumstances that this pandemic has caused for many clients across sectors. I'm going to speak today about the role of employers in supporting COVID-19 vaccine adoption. I wanted to begin by offering two observations on the broader context of COVID-19 vaccine rollout in order to emphasize the important role that employers can play. The first observation I'd offer is that COVID-19 vaccine rollout is progressing. After many fits and starts, we are seeing progress, and I'm showing on my screen some data from the CDC that demonstrates the accelerated pace of vaccine rollout in terms of the number of doses administered nationally per day. We're currently at a rolling average of about 1.5 million. As well as the increase in the health system capacity throughput to deliver those doses into arms. And you see there the significant increase from about 13% when we started the rollout to currently 70% of doses that are distributed are now administered to individuals. So we're trending in the right direction, and there are reasons to be optimistic. That said, the hard work of vaccinating Americans is really only just beginning. As of yesterday, 11% of Americans over the age of 16 had received at least their first dose of vaccine. 15% of those who are eligible for vaccination as part of phase 1, according to the CDC ACIP guidelines, had been vaccinated. The second observation I wanted to offer is that for us to achieve herd immunity and to confidently turn the corner on this virus and to restore lives and livelihoods across the country, we will have to get the vast majority, if not all, of Americans who are currently state that they're uncertain about vaccination. We will have to support them to get vaccinated. And what I'm sharing on my screen is, on the left-hand side, some of the scenario modeling that we've done on the epidemiological evolution of this disease. And based on our analysis, we believe that we would need to vaccinate somewhere between 60 to 100% of eligible Americans to reach herd immunity. You've probably heard Dr. Fauci state a similar range recently of about 70 to 90%. And you put that into the context of sentiment, and the right-hand side here has some of the consumer research that we've been doing, which produced strikingly similar results to what our colleague from NORC shared yesterday. But what we find is that of the people surveyed, about 40 of them state that they're interested in getting vaccinated, and those are the folks who will show up first in line. Another 40% are uncertain or cautious. And about 20% say that they're unlikely. And what's interesting about the data is actually the sentiment has not drastically changed over the last few months as we have gotten more clinical evidence on the safety and efficacy of the vaccines. But the bottom line here is that, again, if we want to reach herd immunity, if that's a goal that we want as society, we will have to support the vast majority, if not all, of those cautious and uncertain people to get vaccinated. So what do we do about that? To answer that question, we analyzed a number of health interventions, both in the context of COVID, you see here testing and masks, as well as more historic health interventions, fluoride, seatbelts, childhood vaccinations, interventions that we've been working at for decades. And we looked at those interventions to understand what were the success factors that drove uptake and adoption of those health interventions. And what we learned is that successful interventions generally correlate with three conditions. The first condition is conviction. So people believing with strong conviction and opinion that this health intervention is important to them, that it's important for them to get vaccinated, to wear a seatbelt, right, to wear a mask. The second condition is convenience. Easy, hassle-free, frictionless, part of everyday life. Every car comes with a seatbelt. It's easy to put on a mask. Fluoride is in your water. You don't even know it. And then last, costlessness. So mitigation of direct and indirect costs, as well as in some cases, positive incentives, and in other cases, negative consequences to not seeking out whatever the health intervention is that we're talking about. So if those are the conditions, it's worth reflecting on where are we as it relates to COVID vaccination and getting those conditions in place. And what I would offer is that we still have work to do, and I'll give you a couple of facts to underscore that. First is 40% of nursing home staff, according to recent CDC data, accepted the vaccine when first offered it. These are staff who had the vaccine free of access, available to them in the place that they worked. 40% accepted it, 60% declined it. That suggests that conviction, at least in that subgroup studied, is low. Convenience. We did a survey of about 800 healthcare workers who already have been eligible for vaccination, of course. 70% of them said that they thought the vaccination experience, the convenience of it, their own personal experience undergoing it could be improved. And then costlessness, we know that low-income populations are both the most vulnerable to this disease, and that there are real cost issues. Even if the vaccine is free, there are real cost issues that they will experience, be it paying out of pocket to get to the vaccination site, or lost wages from having to take time off work to get vaccinated, or to deal with the recovery period. So we have more work to do on conviction, convenience, and cost. What can employers do about it then? It's actually quite interesting that much of the discussion around employer actions, at least the ones that we've been part of, have been around mandates. Should we mandate vaccination? Mandates are a tool among many. They're a blunt force instrument. And as many of us have discussed and recognized, they come with implications, legal implications, ethical considerations, as well as possibly unintended consequences. And so what I wanted to share in the remainder of this time is ideas for employers that they could consider. And we've developed these ideas both on practices that we have heard companies announce, some of which they have started to implement and learn from, We've also drawn from our experience in change management and understanding how leaders across sectors can influence hearts and minds, shift mindsets and behaviors, move people to action. And we've also thought about it from the lens of feasibility, recognizing that actions that some large businesses take would be totally impractical for small and mid-sized businesses. We've tried to think about a set of possible actions, by no means comprehensive, but a set of actions that employers large and small could take. So as it relates to conviction, there are three possible actions. One is to educate on the facts. I mean, we've talked about how vast the information is on COVID-19, on vaccination, how quickly it changes day to day. There's also a lot of misinformation. And employers can play a really important role in sharing authoritative, accessible, understandable information with their workforce and helping them cut through that noise to understand what are these vaccines, what is the safety, what is the efficacy, what are the side effects, what evidence do we have, what evidence do we not have, so that people can make informed choices. Second, on conviction, normalizing vaccination. It's really interesting to hear Crystal speak about the impact of company leaders or organizational leaders speaking about their own vaccination choice, why they're getting vaccinated, how they're getting vaccinated, what the experience was like, how they felt afterwards. That sort of role modeling can be incredibly powerful for the workforce to see their leaders walk the talk. Peer-based normalization can also move people to action. You can think about setting up groups or networks of individuals who have sought vaccination to share their experiences with others and serve as a resource. And then the third on conviction is engaging influencers. We heard from the speakers yesterday about just how important local physicians are to informing people to help them get information on vaccination. So hosting physician and public health panels or town halls or convenings where the workforce can hear from the medical professionals and the scientists and get information and have their questions answered can also be an action that probably larger employers or groupings of smaller to mid-sized employers could organize together. On convenience, there's also a range of actions from easier to harder. Sharing practical information. Where can I get vaccinated? How do I schedule an appointment? What's the closest site? All of those things, that is information employers can provide to their workforce to make it that much easier for them to get vaccinated if they want to. Simplifying the experience. We've heard of lots of employers who cannot offer on-site vaccinations, pursue booking slots, either at pharmacies or mass vaccination sites or with local providers, and saying, okay, this afternoon we booked 10 slots and employees can sign up for that. That's another way to just reduce the friction for employees. And then the last on-site vaccination, we've seen many examples of this. Automakers buying deep freezers, many of the big tech companies announcing they'll do on-site vaccination. We've seen some schools open up their gymnasiums to vaccinate the school workforce in their area. And so there's examples of that makes most sense for on-site workers. And then last, on costlessness, we had talked a few minutes ago about incentives, and we've seen lots of different versions of this, from gift cards to retirement contributions to wellness points to straight up cash bonuses. A number of long-term care providers have provided direct cash bonuses to employees to incentivize them. There's also some companies and organizations that have been looking to cover direct costs, so either offering free rides to the vaccination sites and back, or compensating people for the out-of-pocket costs of transportation. But again, that's about mitigating the cost and the out-of-pocket to the workforce. And then the last, there's also several emerging examples of what I'll call structural support, but providing incremental sick days to go get vaccinated, and then additional days to recover for those who do have tolerability issues and side effects that emerge from the vaccination itself. So again, no means conclusive, but there is a range of pretty practical actions that employers can consider. And to conclude, if you're an employer out there and you're asking yourself, okay, so what do I do now? How do I start? How do I think about this? I would offer that there's a number of issues in the here and now that employers can think through to start to progress towards action. There's also a number of issues that employers might want to start thinking about that are a few months out from now, but may be well worth getting ahead of. In the here and now, I would say many employers are closely tracking workforce eligibility and should continue to do that. It's a highly dynamic environment. And so keeping track of that, planning and preparing ahead can be an important action to continue. Assessing options of what actions are relevant to your organizational context. What are the actual unlocks? What does your workforce need to be supported to get vaccinated? And what is feasible for you given the size and resources you have? In bigger organizations, a cross-functional team with an empowered leader can also play an important role to really get an enterprise-wide integrative response organized. And then collaboration will be important, right? Be it with other private sector organizations in your jurisdictions or public sector or both. I think that there's real power in working together to progress the vaccination agenda. And then last, soliciting feedback and measuring impact. I mean, we are all learning as we go. Nobody's going to get this right from the get-go. And so having a rigorous way to measure and adjust and learn and to be agile will be important. And then looking ahead, there are a number of issues that we see on the horizon having to do with variability in vaccination across the workforce and how employers operationally manage that. Possibly needing booster doses or a more routinized coronavirus vaccination program as we deal with these variants and learn about duration of protection of the current vaccines. Continuing to expand collaboration as everybody's response and efforts to support vaccination mature. And then last, integrating the vaccination effort with an employer's broader efforts to safeguard the workforce and safely return to work will also be important. Thank you for the opportunity to share this today and be part of this really important discussion. And I hope that this has been useful.
Good afternoon, everyone. Great to be with you. I'm Cheryl Pegas, and I'm here today to tell you what we at Walmart have been doing for our communities and all of our associates. As you're all probably aware, beginning last year in March, Walmart was one of several organizations that partnered with HHS in just doing COVID testing in our parking lots. We then went on to run hundreds of HHS testing sites. So as an employer, we've definitely been engaged in how do we provide services. But I think you're also aware Walmart has 2.5 million associates. And so we're providing some of these testings and now vaccines, but we're also educating our associates on the road ahead and what to expect and how to take control and manage that. The first things that we've done, because we do have pharmacists and we do have doctors and other clinicians, is we've spent time learning about the vaccine. And how have we done that? We've spoken directly to the manufacturers of each of the vaccines, and we continue to do that almost weekly to ensure that we have the right knowledge, scientific understanding, so that we can educate ourselves and then we can bring the best knowledge to our associates. We've obviously been offering flu vaccines for many years, so we understand the capacity and logistical requirements, but this is a new vaccine and it is different. And so the training required is different. So we've set up sessions where we are training our pharmacists and our pharmacy technicians, not just on how to administer the vaccines, but really spending the time to explain some of the scientific components. And I think everyone always says, you may not be able to help everyone understand the science. I do think many people understand vaccines. And so the ability to ensure that you are allowing health literacy to enter your communications gives people confidence that they understand what's occurring. And so we've been doing that really from the beginning with ongoing training sessions. We make sure that we've got the safety protocols, the screening processes, testing options, what different states require. So everyone has a common base of knowledge and they can go ahead and ensure that they can then communicate with others. We've done this not just for our pharmacists, but for all of our associates. And we've laid out a number of, we would consider normal channels of communications for any employer, for all of their employees. We've built out our own intranet site with vaccine FAQs. In addition to having these FAQs, we've also held forums where associates could ask any questions. And as many of us are doing Zoom meetings, they show up in the chats. These questions and feedbacks, particularly as you look across the country, allows us to update our intranet site and update our FAQs. And we are doing this weekly. In addition to having that trusted resource, I think many people have talked today about live updates and live updates coming from leaderships. And so what we've been doing is hosting meetings across our business segments, and again, every week, where we're having conversations with business leaders who their associates have grown to trust, who have understood themselves about the vaccines, and we're sharing scientific information. We're sharing the safety and efficacy of the vaccines, but we never leave a meeting without really sharing, here is why I, as an individual, am committed to getting the vaccine. So they get to ask questions. They hear personally from people they've known for a while about why they're getting the vaccines. And we're able to say, here is why you should also get the vaccines. We've also done this with many diverse groups. So it's not just the C-suite of an organization who does this, but we've ensured that different groups across the company are able to lead these sessions. And we've made sure that there's diversity in the people who are speaking so that someone, whether you're at a lower level in the organization or at a medium to high level in the organization, you're hearing from a peer of what their experience has been in either administering the vaccine or why they're encouraging you to get the vaccine. Also gives you a comfort level that you can go back and speak to someone and ask them a question that you may not have done in a national or larger forum. That has been critical for us, and we continue to do that. We get really good feedback from people of how important it was to hear someone from their communities talking about getting the vaccine, or for them to be able to ask a question and recognizing that there are no silly questions, that these are all important for you to understand, and that we as healthcare professionals can explain how to get a vaccine so that everyone understands it. One of the things that's been equally important for us is to ensure that our associates, and we have 2.5 million employees, take that message back to their families. I think we're all aware that if someone is associated in any way with understanding the vaccines or knowing about it, they can help their families in the communities. Walmart and Sam's Club, we have over 5,000 pharmacies in the US and Puerto Rico, and many of them are in the rural areas of the country. We've had, as you know, over 150 million people passing through our doors each week. In many of these cases, the areas that we're in are underserved areas, rural areas, and the associates of our company live in these communities. They tend to be able to allow us to really understand what are the questions and concerns of the community, but also of our associates. And so we're hoping that what we're doing is building out information internally that can also be shared back to the community by people from the community. One of the ways we're doing this is we've built out a public-facing FAQ site. So you can imagine going home and asking a question or giving an answer, and a family member saying, where can I learn more? You now can say, here's where you would go. we've got FAQs, we have information for you so that you can understand about the vaccine, but you can also ask questions and we'll be able to understand and support you. We're currently in the process of launching a vaccine awareness campaign in English and Spanish. We're working with the Ad Council on this and partnering with a number of different minority groups across the country. You may have seen that we recently made a $14 million donation to racial and equity groups, and a number of them are targeting, be it the Indian Health Service, working with NAACP, working with Latinx organizations. It's really for us, based on what we've learned from our diverse employee population, to ensure that communications can be localized and that they are health literate and culturally appropriate. We have 3 areas, however, that we really focus on as an organization, as I've shared where our locations are. Almost 4,000 Walmart stores are located in federally designated medically underserved areas. The commitment for us as we do our immunizations is to assure ourselves that we're partnering with the community, but that our associates who live in that community are able to send messages within their community with trust, as well as being able to feel that there's an ongoing open dialogue. We also work specifically in these underserved communities, not just by ourselves, but with local leaders. Some people have mentioned that already. It's been critical for us for some of the initiatives that we've done. You may have seen a recent initiative on the south side of Chicago that was done with many leaders of the communities, from aldermen to the mayor's office to health professionals. And again, with our team members who work at our stores, who represent these communities and are able to partner. We'll continue to do that, and you'll see us doing more of that as an employer and as a member of the community. Vaccine hesitancy, as we address that, we think communication really matters. Trust obviously matters. The availability of the vaccines really matter. And so we're working to always increase the number of stores that we can provide our vaccines through. And then we also want to make sure that as changes occur, be it in the science or in the health literature, that we're sharing that back. I think the not leaving a vacuum of information is really helpful for people to understand why we're all staying the course and why, as an employer, we really believe in the science of the vaccine and why we're giving the vaccine. Our goal is really to get to where we, with our current capacity, can do 13 to 14 million vaccines a month. And to do that, we're doing it in partnership. We're ensuring that our employees understand why these vaccines are very important. And then we're making sure in forums like this, we can share some of our best practices with employers. I'm thrilled to be here to speak with you about this and happy to answer any questions. Thank you for having me today.
Hello, my name is Steve Hartel, and I'm a Vice President Public Policy at Amazon. I want to thank the Chamber of Commerce Foundation for putting this panel together. And I'd like to start by saying that Amazon, we have over 800,000 employees in the United States. Many of these employees are designated essential and work outside the home. We are proud of the role that our essential workers have played during this pandemic. They have helped people stay safe, receive important products at home, and it's critical, and this is critical for people with underlying medical conditions and that are those susceptible to complications from COVID-19. Since the beginning of the crisis, we have worked hard to make sure that our workers stay safe in their work, and we are also committed to, in this next phase of the pandemic, to assist government with vaccination efforts while making sure to provide essential services during the pandemic. As I mentioned, I work in public policy for Amazon, and we felt it was important throughout this process, through the vaccination period, to give a voice to essential workers in this public discussion. On December 16th, 2020, we wrote to the CDC's Advisory Committee on Immunization Practices, ACIP, and asked them to prioritize all essential workers who cannot work from home, like those working in Amazon fulfillment centers, working in AWS data centers, Whole Foods market stores, et cetera, and other employers and other essential jobs. We asked that that they receive COVID-19 vaccinations at the earliest appropriate time. I want to be clear here. We recognize that individual states are going to have differing priorities and vaccination schedules depending on vaccine availability. We felt that, again, it was important to give a voice and be there to prioritize essential workers, so that, again, those that work outside the home were given early consideration for vaccines. We are working closely with state and local jurisdictions around the country to ensure that we are ready to support the vaccination effort of our employees when they become eligible. And if I can just make a point here, as a national employer like Amazon, and we have employees around the country, following the flow of vaccines down to states, counties, municipalities has been a tremendous challenge. But that said, I know that the panel today is talking about the role of employers in vaccinating our workforce. Let me just speak a little bit about our experience at Amazon. We believe that employers, and especially large employers, should play a role in educating their employees and connecting them to vaccines. Our approach to providing vaccines to our employees is informed by our experience with our COVID-19 testing program. In late March 2020, or in the early first month or second month of the pandemic, we began the process of developing an internal COVID-19 test, and we started building laboratory capacity to process tests so that we could make testing widely available to our workforce. In several short months, in May of 2020, we received federal CMS CLIA certification, and that's the organization that certifies labs. And we got approval to develop our test through a CLIA certified lab. We've subsequently received an FDA EUA we did this summer to begin testing make testing available to our employees. Presently, we are running an average of 100,000 tests per week, and have run easily over 1 million tests since the program started. Given that the United States is conducting about 11 million tests a day, on any given day, Amazon is administering between 1% and 2% of total tests administered in this country on any given day. We are proud of this work, and the results, we believe, will help inform our work and our approach to vaccinations. First and foremost, we had to make testing available at the workplace, in our buildings. Testing had to be ubiquitous and consistently available to drive broad-based participation. We offered off-site testing in the early days of the program and quickly moved to testing on-site. We found that just the added logistics of leaving the workplace and driving and going to a third party was a significant deterrent to going forward and getting the tests. So as we think about vaccines, we think making vaccines available at work, making them consistently and regularly available, and having managers, site leaders, leaders in the company get vaccinated on site will be strong components to drive participation. All of these things you've heard the earlier panelists talk about, but it has also been our experience in our testing program. We are working hard to be ready to conduct mass vaccinations of our essential workers when sufficient vaccine supplies are available. We are working with licensed third-party occupational health providers and national pharmacy chains to set up dedicated on-site and off-site opportunities for our workers to get vaccinated when they become eligible in their respective jurisdictions. Today, while we are still in the early in vaccine distribution, subsets of our workforce, such as Amazon pharmacy workers in Arizona, grocery workers in New York, have become eligible for vaccines in their jurisdiction. And when that happens, we inform them as quickly as possible, share information from state and local health departments that they can use to find an appointment. We strongly encourage our employees to choose to be vaccinated when they are eligible, specifically letting them know that all approved COVID-19 vaccines are safe and effective and proven to dramatically lower the risk of severe complications from COVID-19. We also, by receiving vaccination, workers will help protect themselves, their loved ones, their coworkers, and their community. And as we stated in our letter to President Biden last month, we stand ready to help vaccinate our essential workers. We think that our help will assist the administration in their goal of vaccinating 100 million in the first 100 days, and perhaps that could be 150 million. But again, we feel like we will have a role, as will other employers, in helping get there. We've offered to work directly with the federal government and to accomplish this, or we can work through the states, as I mentioned earlier, kind of depending on how the vaccines are administered. What is most important here is to provide clear information to workers about their eligibility to receive vaccines, and then the ability to offer vaccines on site will make a huge difference in the number of vaccines that get administered. I would just say a couple of other things. Amazon is actively supporting state and local vaccination efforts. And we've done this, in a number of different locations and different kind of opportunities. I'll just mention a couple. In Seattle, Washington, we have partnered with Virginia Mason Hospital Center to host pop-up vaccination events. We've done these on consecutive weekends, and in each event exceeded the targets for vaccinations by 20 to 30%, and each event vaccinated over 2,000 people, community members. In Groveland, Florida, we're using an inactive Amazon delivery station for local community vaccination site, and the city is administering drive-through COVID vaccinations. They're using again a parking lot with state officials doing administering the actual vaccines with Amazon volunteers assisting. And then similarly, in Tucson, Arizona, we are providing non-clinical volunteers and supplies, helping clinics that are serving residents 75 or older, educators, and law enforcement. We believe that as I mentioned, we believe that that Amazon will have a role and play a direct role in helping with essential workers receiving COVID-19 vaccines. And we look forward to working with the Chamber and the other assembled panelists as we move into a question and answer phase here. Thank you very much for having Amazon on the panel, and look forward to questions. Thank you.
So going back to Tara for a moment. Hi, going back to Tara for a moment. You had a slide up there that showed herd immunity, and you had some projections.
Yeah.
And you contrasted that with public attitudes about the vaccine. What happens if we do not reduce the percentage of people who are unwilling to receive the vaccine?
You mean if we don't reach herd immunity rates?
Well, can we reach, is there a way to reach herd immunity if that's such a high percentage of people are unwilling or deeply skeptical of the vaccine?
Yeah, I should caveat by saying I'm not an epidemiologist, but I would offer two reflections from the work and the discussions I've been part of. One is we don't know what level of immunity we'll need to reach herd immunity and suppress the virus. Nobody knows that. And I think many of us listen to what Dr. Fauci says, and the latest hypothesis from him is 70 to 90%. So let's take that as at least a hypothesis. The second is if we don't reach herd immunity, what we're likely to see is the virus continuing to circulate and circulating in relatively under-vaccinated populations. And the reality will then be that we live with this virus for some time, and it will continue to cause morbidity and mortality at rates that would be higher than if we had reached herd immunity and suppressed it more fully.
And Steve, you talked a lot about the importance of vaccinating essential workers and working to kind of build on the great successes of your testing program. What do you need in order to vaccinate I think you said you have 800,000 employees. Like what do you need and how long would that take?
Well, thank you for the question. And the important step for us was to we are kind of following the process that's been laid out to date. One of the important things that we need if we're going to do on-site testing is to have that third-party vaccinator. And so that's been something that we've been working on, making sure that if we get to a point where essential workers are eligible and there are vaccines available to be granted to start that process of vaccinating essential workers, we're ready on site where we have, there's over 700 locations where we're doing testing. And so those sites are suitable for on-site vaccinations. And now that we have kind of these third-party vaccinators in place, it's simply now, those vaccines flowing down to the state task force or to those localities that are administering them and starting the process. Alternatively, should there be a process where, as more vaccines become available and the federal government starts to grant them directly to start vaccinating frontline essential workers, we believe that we can add capacity to the system. And so if we're vaccinating in our fulfillment centers, then we're not sending those people out to community sites for vaccines, which will create, greater availability. The question will just be, again, at what point are vaccines chasing people as opposed to people chasing vaccines?
No, that's great. Thanks. Dr. Pincus, I really like how you laid out in really sequential order the steps that Walmart is taking to educate its associates, to build health literacy, to help prepare people for access to the vaccine. Because you operate in, I think probably every corner of the country, it would be interesting to get your perspective on how you engage with state officials. That's a frequent source of conversation within the business community, especially among companies with operations in multiple jurisdictions, just how challenging that is. How has Walmart worked through that? And do you have any advice for other companies as they think about ways to kind of build health literacy among their population and build public-private partnerships like the ones you're working on?
Oh, thank you for those questions. There are a couple of pieces in there, so let's take each one in hand. Let's start with partnerships with the state. I think we've always maintained partnerships with the state, mainly around, we are an employer in many states. We encourage people, even at young ages, to begin when they start out with their first jobs, working at a Walmart. And so those conversations of how do you provide services in the community have existed, first around the employment aspects, but as well as a partner in many of the states. I'm sure you're aware, Walmart partners on other events with the states. We partner on community events. And so we've got a very, I would say, experienced, but a team that has really good relationships around the state. And that's important because states at this time are really stressed. And so you've got to communicate the information that they may need, but also be able to follow through and be able to come back with either results or an updated report. And so we spend time investing in those relationships. The states are the ones who, in most current distribution of vaccines, are responsible for ensuring where vaccines will go, but states are very cognizant of looking at medically underserved and rural areas. And because in many of these states, Walmart is really the only place so that you can receive vaccines, that partnership has really heightened. We're able to share with them, here is where we're located, and here's our capacity to be able to provide vaccines. That is not the only channel in how vaccines are delivered. So states have allocations. The CDC, through the federal direction of giving vaccines, also provide allocations. And we reported today that we began receiving that allocation. So we're getting vaccines through the state. We're also getting it from the federal allotment of vaccines. We, however, no matter where the vaccines come to in a state, follow the state guidelines in who gets the vaccines. And so the ways we're doing that are, one, we're tracking all of the requirements that are available by state. And we've built out a digital platform that is unique for each state. So it's one platform, but as the requirements change, you can go online to walmart.com and schedule your appointment, and we can allow you to determine all of your requirements right at that time. So if you don't want to keep up with 50 states and 50 different requirements, we actually lay it out and update it. That's really important, because I do think one of the things that we have to do as we give these vaccines is be able to track. So we allow people to put in and get text messaging for follow-up, so they come back for their second vaccine. But we can begin to do, I think, what you've heard a little bit earlier today from Tara. How do we track how many people are getting vaccines? How are we able to report that back to a state? And as you think of as an employer, how are we able to report that back to an employer? And so employers will want to know, where can we send our employees for vaccines? As you just heard, our ability to be able to give the vaccines, generate a report, generate reminders for people to get their second vaccine is critical. So digital tools really help here. I'll just mention about health literacy. You know, health literacy is one of the areas that I think all of us who've worked in healthcare have known it's something that we've got to address. We understand that cultural concordance matters in health literacy. We understand that trust is local, and you've got to make sure that people are speaking with people who they already know and they believe. And you also have to be able to provide people with answers to their questions. They're all three really critical for health literacy. I'd say we have built out a number of these channels. I think, you know, and I think as a doctor, I can say this, pharmacists are incredibly trusted in their communities. The questions that you may not sometimes ask a physician, you'll speak to a pharmacist about. And because most pharmacists work in their communities, that relationship is built up. You see them every day. You know what you can go and ask them. And so I do think we all have to think of health literacy around COVID-19 and around health, and who are the messengers, and not just think that it's clinicians, but it's really everyone along that stream who comes into contact with someone who's seeking care. And that's the model that we hope we continue to bring as part of our health and wellness work that we do within the organization.
Well, and thank you for the work that you're doing and that Steve's doing and that Tara's doing. We really appreciate your time and sharing your expertise today. All of our panelists have shared a lot of really important information, and you can find a copy of this on our website or on YouTube. I know a lot of small employers would love to copy what some of our guests are doing. So if anyone in the audience or on the panelists has information they want to share, playbooks, guides, anything like that, let us know, and we'll make it as publicly available as possible. And to all the people who joined us for this important conversation, thank you. We think employers have an important role to play in the fight against coronavirus. We covered a lot of ground yesterday and today, but here are some of my big takeaways from the conversations. One, vaccine hesitancy is a real concern. 2, we must pay careful attention to the concerns of people who are hesitant about getting the vaccine, and we have to treat them with empathy, especially those who fall within the racial, ethnic, or political groups that are most skeptical of the vaccines that have been developed to prevent the transmission of COVID-19. We know the vaccines are safe and effective, but it's not enough for someone like me to say that. We need to have credible messages from credible messengers, including employers. And last, we just heard it again, local matters. So it's really important that local leaders, local businesses communicate localized messages that convince people of the importance to all of us. Because as we heard earlier, coronavirus anywhere is coronavirus everywhere. Some of our guests have shared insight into the best way to talk about these issues. I encourage you to do some more thinking about how you communicate with your employees, whether you own a business, run a charity, or some other kind of employer. We want you to do so in a way that is most likely to stop the spread and promote vaccination. Ultimately, it is essential that all of us work together to vaccinate America. We'll continue to share information at uschamberfoundation.org. You can also join us next week for the next episode of Path Forward. We're going to host a conversation about the mutations and the variants that are in the news today. And we're also going to talk about what that means for our long march toward herd immunity. Until then, thanks again for joining us. Be well, stay safe. Have a nice day.